today to teach you about the Whirlpool and its uses. The overall goal of the Whirlpool is to accelerate healing, and some of the indications are to increase circulation, decrease pain, and also the debridement of wounds, which is what we're going to be doing today. One of the major things with the Whirlpool is the biggest contraindications is active bleeding from the patient and also maceration of the wound bed itself. So Reiko's actually going to give you some more of the precautions that are involved with Whirlpool therapy.
So precautions are granulating wound and epithelialization, also new skin graft, and venous ulcer and diabetic ulcer.
Okay, first things what we're going to do is we're going to make sure that the tub is cleaned out from the use before. I'm going to come around and actually turn on the water. I'm going to use putting it to the left. I'm going to let it rinse down a little bit, and then I'm going to close the top. As this is filling up, what I'm going to do is I'm going to prep the patient's area. Since we're going to be using Reiko's left arm, what I'm going to do is make a little padding here for our patient. So when her arm is hanging over the end, even though it's only going to be for a few minutes at a time, she still has adequate padding underneath her. I'm going to use some tape and actually put it over to the end. We want to stay in this green area, which is approximately 90 minutes. Also for your prep, what you're going to need is going to need sensory hammer, hot and cold tubes, and also the cleansing agent that's going to be used for the patient. And be sure to ask about any patient allergies during your patient interview. And just kind of keep an eye on the water as it's coming up. And also gather a bunch of towels. What you're going to do is have a prep area for the patient when they're actually coming out of the pool. It's filling up. I'm going to prep a little station for when the patient is actually out of the bath. Keeping an eye, knowing on what limb you're going to be working with. Since we're working with an upper extremity, I can go up a little higher so Reiko doesn't have to lean over the edge. So I'm just going to put a couple towels down so the patient will be ready for when they come out. And also an extra towel I'll have to put on the patient's lap so they don't get wet as well. So again, I'm checking the temperature. It's going to be around the right degree. I have a couple more minutes before I bring the patient in. I want to make sure that the water level gets level. Okay, now that your tub is full to the water level that you need it at, you're going to actually turn on the machine and check it before you bring your patient in the room. And you're also going to add, we have what is called a hydrochlor, which is going to be our cleansing agent. You want to add that to the water so it starts dissolving. So this top toggle switch will turn the whole motor on. So I'm going to go ahead and I'm going to open this. It's just a packet. And you drop the packet completely into the water. Okay. I'm going to test the agitator before the patient comes in, and I'm going to turn it to the right. Slowly do it because as it gets picking up, it actually churns up a lot. And as you can see, your little packet's dissolving. And you can see a slight whirling so you know that it's working for the patient. Hi, Reiko.
Hi.
I'm Jane. I'm your student physical therapist for today. So what we decided to do for that wound that you have there on your arm, we're going to use Whirlpool therapy on it. So what it's going to do is we're going to fill the tub up. It's going to get to a nice warm temperature, and we actually add a cleansing additive to it and use some circulation and hopefully get that wound to start healing and accelerating. Okay, does that sound good to you?
Yeah, great.
Okay, Reiko, since this is the first time that you're receiving Whirlpool, I just have a few questions to ask you. This is regarding any pain that you were having. Can you describe that pain for me?
It's dull.
In that area? All right. And on a scale of 0 to 10, with 10 being the worst, how would you rate your pain?
5.
Out of 5? Okay, great. And Reiko, are you being treated for anything by a physician, such as diabetes or hypertension or peripheral artery disease?
No.
Okay. Are you allergic to any medications? Are you on any medication?
Oh, no.
No medications? Okay, any past surgery for anything? No surgical history. Okay, do you work? Okay. Do you sit or stand most of the day?
Sit.
You sit most of the day, okay. Just checking. And also, do you have any hobbies, like sports or anything that you like to do?
Not really.
Not really? Okay, that's okay. And another question I'll have for you. in the past, say, 3 months, have you noticed any, excessive weight loss or extreme fatigue that you can't pinpoint? Okay, I just wanted to make sure before we do the treatment with you. Okay, so I'm going to look at the wound. What I'm going to do is actually look and assess her wound before, and I'm going to let her know before we go into the Whirlpool that we'll do some sensory tests. I'm going to test your sensations for hot and cold, sharp and dull, and for a soft and light touch, okay? And just as a double check, I'm going to make sure that the wound is not actively bleeding. She's had no surgery or anything, so there's no new skin graft, and I'm not looking at any epithelialization of the wound bed itself. And I don't notice any maceration, which is excessive moisture into the wound, which is something we have to look for after we do our Whirlpool care. Okay, now I'm going to test sensation for you, Reiko. All right, I'm just going to place this towel here, just, since we're going to be by the water and everything like that. So I have 2 test tubes. One contains hot water and one contains cold water. The hot water is not that hot. It's actually just a warm water. If you put your hand out, there. It's not that bad, right? Okay, so I'm actually going to use this hand for you. And what I need you to do is let me know when I touch you with either test tube, hot or cold. Okay, ready? Hot. Okay. Cold. Okay, great. Now actually I'm going to go to the up and around the wound. So I'm going to go ahead and test distally. Hot. Okay. Cold. Okay. And now I'm going to go above. Hot. Cold. Great. And I'm going to do another couple tests on you. Don't want to be really brief. One is for soft touch. Very simple. It's this little brush here. It's like a little tiny soft brush. So again, I'm going to use the uninvolved hand. So just let me know yes or no when you feel it.
Yes. Yes.
Okay, and now I'm going to move on to around the wound. Ready?
Yes. 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 Yes.
Great. And one last final test is for sharp and dull. Very simple again. Sharp is almost like a tack, see? And the other side is just flat. All right, so again, I'm going to test this side. Let me know what you feel.
Sharp.
Okay,
Dull.
great. And now I'm going to move on to your affected side.
Sharp. Dull.
Okay,
Sharp. Dull.
great. Thank you so much, and we can get started with your treatment very soon, okay? All right, Reiko, so we're going to get ready to do the treatment. Actually, what I'm going to do is I'm going to turn on the machine and get used to that sound. This is just the sound of the machine, okay? And what we're going to do is before I put your hand in the water, I'm actually going to test with a gloved hand, a clean hand. I'm going to test the temperature myself in the patient. So you see. And it feels good. So I think we can go ahead and start the treatment. All right, so Reiko, what I want you to do is gently, I want you to bring your arm up and over the edge and slowly bring your arm into the water. Okay, and submerge it. Great. And then I'm going to slowly start pushing to the right. What you're going to do is it's going to start whirling around, okay? It's going to be very slow to start, and then it's going to start building up. If at any time you feel uncomfortable, you don't like it, let me know and we'll discontinue, okay? So I'm going to slowly start. Ready? Like I said, it takes a couple minutes for it to start circulating, so it might seem a little slow at first, but it'll start churning up and it'll get faster. So I'm slowly turning the knob to the right. Takes a while for the turbines to get going. There we go. And can you feel a gentle sensation? How's the temperature?
That's great.
Temperature's okay. There you go. How's that feel?
That's good.
Are you comfortable sitting like that? Okay, is your arm comfortable? So if I want to get it turning around to get it moving, that feel okay for you, Reiko? So Reiko, I wanted to have your first session be about 10 minutes. So what I'm going to do is I'm going to start slowing down, turning to the left. I'm going to start slowing down the agitation on the water. So just sit tight. And you'll slowly stop feeling are you slowly not feeling it anymore? And I've secured it all the way to the left. And I'm going to turn this off. Okay, so just hold tight for 1 second. I'm going to start draining so it makes it a little easier to dry the patient off. Well, I got it halfway down. All right. So Reiko, if you can just bring your arm up, and I'm actually going to grab a clean, sterile towel. And can you place your arm over the towel, please? And I'm going to gently pat dry the wound. How was your pain on a scale of, say, 0 to 10, with 10 being the worst? Do you feel like it's...
3.
Great.
It feels better.
Great. Great. So what you're going to do now is you're going to reassess the wound and you're going to take a look at it while you're drying the patient off thoroughly. That's dried. You'll take another clean, dry towel, and what you want to do is sterilely cover your wound. Cover it up so that your patient either transfers into another room, or maybe if you're in the hospital, the patient has to transfer back to their floor. Okay?
So if you want to treat the lower extremity of the patient, she's going to be on this chair and make sure she has safety belt on, just like this, and assist the patient and put her leg in the Whirlpool. This is inappropriate positioning.
Hey Doc, what's up?
Marty, great, you're here. What's wrong with your hand?
I heard it playing the guitar.
Marty, I warned you about that thing.
I know.
Don't worry, I have the perfect device to help fix it.
Cool, what's it called?
I call it Pre-Mod Pain Relief.
How does it work?
Well, first, we have to perform a sensation test and inspect your skin.
Cool, let's do it.
So here's what we got right here. Tell me, where's the pain?
It's right there.
Okay, so here's what I have over here. I have a cold tube and a hot tube. Just look away for a sec, Marty.
Okay.
You let me know which is which, alright?
It's cold, Doc.
How about this one?
Hot.
Okay, seems to be that your sensation's intact. Now I'm going to test for a different test. Right here. Don't be worried,
Whoa!
Marty. Don't worry, don't worry. It's just a little pin. It's not going to hurt you. It didn't hurt Einstein. And what I'm going to do is just, when I pick you, you tell me it's sharp right here, and the other side is going to be dull. Alright?
Okay.
Look away again. Don't be scared.
Sharp. Dull.
Wow, Marty, your sensation is completely intact. We just have one more test, and then we'll be on our way to getting rid of your pain. So right here, it's just a light brush feeling. Nothing to be worried about here.
Okay, Doc.
Once again, look away. Let me know when you feel it. All you have to say is the word now. Okay? Here we go.
Now. Now. Now.
Great. It works. Now we're ready for pre-mod pain relief. Okay, Marty, first we have to plug into the outlet. There, now we can turn on the machine. At this point, we wait for the machine to fully load. It has to warm up to its natural calibrated settings. I don't want you to get hit with any unnecessary voltage spikes. These machines can go as high as 1.21 gigawatts.
1.21 gigawatts. Doc, I don't want to get zapped.
Don't worry about it, Marty. As long as it's not connected to you while I turn it on, you're not going to get zapped. Okay, Marty, now that the machine is fully on, first we have to connect the leads. I put it here onto channel 1. You want to open it up, make it nice and neat. This is not nice and neat! Now that the cords are entangled, we can finally get the pre-mod pads on. So, we have two techniques of doing this. We can use a bipolar technique or a unipolar technique. The bipolar technique uses two pads. The unipolar only uses a small pad and a big, large dispersive pad.
Cool.
So for you, Marty, we're going to need to use a bipolar technique. It's two small pads.
With it, Doc.
So once I plug these in, I'll be able to put them onto your skin. We'll have that pain out of here in no time.
Where are you putting it, Doc?
I'm going to put it surrounding the pain. Tell me, where's your pain, Marty?
Right there.
Okay, Marty. Now you told me the pain was over here, right?
Mm-hmm.
Let's put it right here. One pad, and I'll put the other pad right around it. Right here. Remember, Marty, when putting onto these pads onto your skin, make sure they do not go over bone.
Okay, no bone. Got you, Doc.
Okay. Now, going back to our machine here. Okay, so what you'd want to do is you'd want to press the pre-mod setting right here. By pressing the IFC and pre-mod button twice. Once for IFC, the second time for pre-mod. Then, you would move down to make sure it's on channel 1, and you could adjust the time, and you could adjust the frequency. For the frequency settings, we'd want to change it. Right now, they're on high frequency for 80 to 150. Well, since this is a small muscle, we're going to change it for low settings, which goes from 0 to 10. But we're going to change it. We're going to increase this number from 20, and this number 50. Now that we've got the right calibrated number of frequency settings, all we have to do is just raise the intensity and then press start. You feeling it, Marty?
Yeah, I'm feeling it right there, Doc.
Perfect. So at this intensity, I would press start. And the time go down. And for 10 minutes of treatment, you will be feeling this exact sensation.
Should I be touching these while you're doing that, Doc?
No, Marty. Under any circumstances should you be touching the pads.
Okay, so don't touch the pads at all.
Don't touch the pads at all.
Okay.
Great Scott. Okay. Okay, Marty. We're at the last 10 seconds of treatment. Any second now, machine, the tingling sensation will stop. In 3, 2, 1. Precisely. Just as expected. Okay, at this point, you want to press the stop button. Make sure all the machine is fully off. I like to turn off the switch. So we want to be keeping about those 1.21 gigawatts. So I want to remove the pads, nice and easy. There we go. And I want to unplug the leads. Put all your equipment aside. Remember, you want to tangle this all back up. Of course, nice and neatly. Otherwise, it just looks like mad scientists have been working here. Great. Now, what I want to do is do a re-inspection of the skin. Tell me, Marty, how does it feel?
It was good, Doc. What did you do?
Like I said, pre-mod pain relief.
Stop.
All right, Marty, how are you feeling?
Great, Doc. The pain's gone. You're telling me you built a machine that reverses pain? You're gonna be rich.
No, Marty, don't be foolish. We can't build a machine that reverses pain. See, you have to understand that the body is like a semiconductor. It uses the two pads to target the pain in a specific area using the gate control theory of pain.
Oh.
So you
Can,
get-
can, can you drill it for me, Doc?
Precisely. All right, Marty. This is your arm. This is the pain of your arm. We put the pads in these two directions. The leads are connected to the pre-mod. Right here, this creates a summation of waves going back and forth, making sure that the pain is completely being targeted, producing a tingling sensation.
Doc, could we use this on larger muscles?
Of course we can, Marty, but I suppose we need more pads. We can put a pad right here, and put a pad on the opposite side right over there.
Would that still be pre-mod?
I don't know. I don't think so. And then it would create this kind of wave in an X formation.
What would you call that?
I would call it the individualized flux capacitor.
How about we call it IFC for short?
All right, I suppose we could call it that.
Thanks, Doc, so much.
No problem, Marty. Let's get headed on our way.
What are you doing? Don't you need those for the next treatment?
Pads? Where we're going, we don't need any more pads. So here is your arm.
4 fingers. Whirlpool, great. Whirlpool training. There you go.